so I'm going to do a physical assessment, a postpartum physical assessment. Alright. We're going to wash my hands. I'm going to knock on the door for privacy. Hi, my name is Heather. I'm going to be your nurse today. I'm going to do an assessment on you. Is that okay? She'll tell me yes, it's okay. I'm going to ask her name and date of birth. She'll tell me your name and date of birth. And then I'm going to ask her if she's gone to the bathroom recently because you want an empty bladder to do this assessment. She's going to tell me, yes, she just went a couple minutes ago. And say, good. All right, and first we're going to examine your breasts. So I pull her top down. I notice she's wearing a bra. Okay, and then we do that so we can look. And we're looking for any redness. I'm not seeing any redness. I'm going to ask her if she has any tenderness. Tell me she's not having any tenderness. I'm going to ask if she is feeling any discomfort. I'm going to ask if she's breastfeeding. If she's breastfeeding, then I'll ask her how breastfeeding's going, how she's feeling about it. And then if she's not, then I'll tell her ways to try not to stimulate breast milk production. Okay, we'll cover back her top hat. And I'll put some gloves on. Put gloves on. Now we're going to listen to bowel sounds. So we're going to listen in the 4 quadrants. And if we don't hear any sounds, we'll listen for 5 minutes before we note no sounds and notify the physician. But we hear bowel sounds, they're very active. Okay. So next, what we're going to do is I'm going to roll you over. I'm going to check your lochia. I'm going to check you for hemorrhoids. I'm also going to check out your episiotomy. Okay, and I do have gloves on. So now we're going to roll. And then we're going to take the pad out from front to back. We're going to look at the lochia. We're noticing a scant amount, but if we did see a very large amount of the pad like filling up within an hour, then that's something we should notify the physician about. So we take that one out, get a new one. And then I'm looking at her episiotomy. It looks nice and closed. I'm not noticing any sign of infection. We're also checking out her hemorrhoids. She does not have any signs of hemorrhoids at the moment. So then we're going to put in a new pad. We're going to put that in front to back. And cover her all back up. We're going to roll her back over. And I'm going to ask her about her bonding with her baby. If she feels they're bonding very well, she's going to tell me, yeah, they feel like they're bonding really good. I'm going to ask her if she has any questions or concerns. She doesn't have any at the moment. And then I'm going to take my gloves off. I got my gloves off. And now we're going to look for edema. And I'm looking at her face, noticing if there's any edema. We're looking at her hands. We're checking for edema. We're looking in the legs, checking for edema. I'm going to ask her if there's any pain or tenderness in her legs. We're checking for blood clots or DVTs. And she's not noticing any pain. I'm not seeing any redness. So that's good. And I'm going to tell her if she does have any more questions or concerns, that she can come to me and ask. Now I'm going to wash my hands. And then I'm going to document all of my findings, provide for privacy, and link.